Hi everyone, and welcome to our next session. So in this session we'll be joined by Erica Brown as she talks with Daniella about her experience as a sibling. I had the privilege of hearing this story told firsthand as we recorded this interview, and there are so many incredibly touching and emotional moments throughout. We often talk about the experience of trisomy for parents, but a lot of the time we don't necessarily talk about the impact that that has on siblings or grandparents, for example. And in this story we get to hear a little bit of that insight from a sibling's perspective on how trisomy affected their lives. So it's my pleasure to talk about Erica and Daniella as they talk through sibling stories.
So, Danny, would you like to tell us a little bit about yourself, please?
So I am living in Wales with my husband and two children at the moment. I've been a trustee for SOFT for, I think it was nearly 10 years. I can't quite remember now. But I became involved in SOFT properly about 5 years before that, when I was editing the newsletter. And that all kind of came about because my mum had my sister Beth, who had trisomy 13. And Beth was born before I was, so she was born about 18 months before I was, and she survived for 3 months. So I was never actually around at the same time as Beth, but certainly growing up, I was very aware of Beth and her impact on our family, and kind of, I suppose, her ongoing impact in the way that their mum went on to kind of co-found SOFT. And so I had all that growing up, even the experience. I suppose growing up, I had that experience of trisomy without actually having had Beth there. So yeah, I think it's quite a different sibling experience of trisomy, because I was never around at the same time as Beth, but certainly, being born into a family that had a child with trisomy and had sadly lost a child with trisomy, I suppose that did slightly shape my upbringing.
I'm sure so. And so you grew up in a family where Beth's memory was very much alive, and I guess there were photos of her around and little mementos around.
Yeah, there were photos. There wasn't much else, I suppose. There was one on the wall, and most of the other ones were in photo albums. I don't know whether that was a conscious decision by my parents to. I don't know. It was there if we wanted to look through photo albums, but there weren't loads of things displayed around the house. Um, but I don't know whether that was subconscious or conscious on their part. But it was more, I suppose, mum's work with trisomy that was keeping things, I suppose, keeping me aware of trisomy 13 and 18. And mum was writing like the booklets, and often would suddenly get a phone call from a parent, and so we'd have to clear out of that room, and she'd sometimes be there for ages kind of counselling them. So I suppose it was more keeping Beth at the forefront of our minds in other ways, rather than necessarily things around the house. It was
Yes,
mum
yes.
did
Yeah.
afterwards.
What's your first memory of SOFT then? Can you remember? Would it be going to weekends and things, or was it about mum actually working, sort of from home with all of the activities of SOFT around her?
I think a bit, but it's all very like intertwined. So I remember being very young and it being quite an event when trustees would come, and they'd have a trustee meeting at our house, and so they'd all come and visit, and so it'd be quite fun, because there'd be all these people that I kind of knew coming for. They'd do their meeting, but then they'd be around for dinner and stuff afterwards. But yeah, as I said, mum taking phone calls, mum going through all the reams of booklets. I remember her doing lots of work around SOFT at home, so that being kind of part of normal home life. But then equally, from quite a young age, I remember it being a kind of yearly event that we would go to the SOFT conference. And I think she's every now and then parades out photos of me in the creche when I was tiny. And I don't know what the first memory was. It was just kind of always there growing up.
Yes. Yeah, I mean, it just became integral to your life, really, didn't it? I think. Can you pinpoint, and this is probably quite difficult, but I'm wondering whether you can pinpoint any of the sort of feelings that you had as a tiny growing up about, was there a sort of a mystery about Beth at all, or was it just a very, for you, was it just a very natural, a natural sort of part of your family story?
A bit of both, I suppose. It was very much part of family life, you know, soft, and the work mum was doing with that. I suppose Beth herself was maybe more of a mystery because I'd never been around at the time. Um, and I mean, it's difficult for a really young child, but I knew obviously it had been very upsetting and a traumatic time for the family.
Yes.
So I don't think I ever really pried too much. Yeah, I kind of remember, I think when I was really small, thinking, you know, what would it have been like to have had a, you know, sister that was only 18 months younger, because otherwise all my siblings are much older.
Yes.
It would
Yes.
have been, it would have probably been a very different childhood having a sibling close in age had she survived. But then there was also the, well, if she had survived, it wouldn't be, you know, like having a sibling that my friends have down the road, they're out playing together. It would have been having a sibling who had lots of difficulties and disabilities. So I do remember as a child kind of contemplating the, well, what would have happened. And I think mum even said when I was quite young, I said to her, well, if Beth had survived, I wouldn't be here anyway. And which is probably quite true. Things work out in different ways, don't they? So yeah, I think it was something I wondered about, but I don't think I really questioned too much, I suppose, for, I don't know, fear of upsetting people maybe. But
Yes.
I think everything mum did, from when I was around, everything mum did was very kind of proactive and was, you know, sorting things out and helping people and creating soft, and it was all kind of moving forward. They weren't, I think maybe then I knew it was all because of Beth, but they didn't dwell on the kind of bereavement. I think she kind of used it to kind of chuck herself in and keep her busy and
Yes. Yeah.
doing things. So I kind of just went with that. That was
Yes.
that
Yes.
was good.
Yeah. You say you wonder whether you sort of protected your parents by not asking questions. That's something that is, it features quite a lot when you talk to adult siblings. The fact that it wasn't that the subject was taboo, it was just that actually, yeah, often quite young children stepping in and wanting to look after parents. So I think what you're saying there is unique to to that sort of sibling experience, and it seems to come about whether whatever the gender of the sibling was as well. You know,
I think they would have been very happy to talk more about her if I had questions. But
yes.
I suppose one of there never seems to really probably be the opportunity, does there? You're always busy doing things. You don't want to suddenly start asking questions about something that was really painful for them and difficult for them in amongst everything else. So I suppose there wasn't necessarily the opportunity. I'm sure they would have wanted to talk about it if they thought I had questions. But I do wonder if, I don't know, if there had been, maybe if there'd been more opportunity, I would have done. I don't know, you know, kind of giving the opening of, is there anything you wanted to ask, or is there anything you wanted to talk about? And I probably would have, I mean, I can talk quite a lot, so I probably would have then came out with lots of stuff. But I suppose for neither of us, that didn't really raise. And actually, it's funny because just thinking then about what you were saying, I don't think I've ever actually spoken to my siblings about their experience of having Beth around, because they, you know, my brother and sister were, I think, about 11 and 12, and there's, you know, pictures of them cuddling her, and but even to this day I don't think, you know, obviously we talk about Beth in passing and things, but I don't think I've ever had a sit down conversation with them about how it was for them, and which is quite odd, I don't know, thinking about it now.
Not at all. Again, this is something that past interviews with siblings, this is something that's been very much at the front of the agenda, is the fact that often siblings just either haven't talked or have never had that entree into the conversations, really. You know, they've never had the opportunity to tell the story, not because it was a subject that wasn't on the agenda, but more the fact that it just didn't happen. And can you remember, did you talk to your then peer group? Can you remember as you grew up and you know, you have friendships and people come home for sleepovers and all that sort of thing? Do you remember that there was ever any mention about your sister? Do you remember talking about her at all?
Yeah, I don't think I talk about it much, but if it kind of came up in conversation somehow, I would talk about it, but then never probably in too much detail, because I think as soon as you kind of vaguely get into that conversation and then it comes out, well, I had a sister that was born before me that died, other people don't really know how to handle that, and so then they kind of get a bit awkward. And I think I was always quite matter of fact about it. Part of me, I don't know, maybe because I wasn't there at the time, but I think other people, if I ever did mention it, would always be quite shocked, and I don't know, would then almost start feeling sorry for you, when I in some ways I feel slightly detached from it, because I suppose I wasn't there at the time. It's just, that's always been,
of course,
that's always been kind of the makeup of our family, really.
Yes. If we think about you now telling your story, and we think about where you are now in your own sort of parenthood, and if you can cast your mind back to when you were expecting your first child, was there any sense within you, I wonder, of sort of apprehension?
Not apprehension as such, but I think it definitely has shaped me slightly as a parent, in that when I was, well, is it that or is it other things? It's just difficult to determine, isn't it? What aspects of your life contribute?
Yes.
But definitely when I was pregnant and with my son, even now slightly, but maybe less, you know, more when he was a baby, I was always very aware that he could pass away, he could die, we might not have him for that long, which was silly because I had a normal pregnancy, he was a very healthy baby, there were never any problems. But I remember saying to my mum, you know, I don't want to leave him to cry, because if he did die, I want to know that he was happy and loved for the time he was here. Which she then was like, that's so morbid, that's horrible, you think that? And I said, well, no, I'm not worrying about it, I'm not anxious about it, it doesn't make me unhappy, I want him to feel loved for the time he's here. But she said, she was kind of, I think she found it a bit baffling that I was worried about that, or that was even crossed my mind. So yeah, I mean, I'm sure that partly will be because of Beth and my experiences of, you know, family. But yeah, I don't think it's impacted me in a negative way. I think maybe it's just made me more aware of how lucky I am that he is okay, and I kind of want to appreciate that and, I don't know, look after him.
Because of your long-standing experience with Soft and all of the opportunities you've had of meeting families, I'm wondering what sort of advice you would give to parents now who have either siblings who are growing up with a brother or a sister who is affected by trisomy, or a brother or sister who's died, what are the sort of the key points that you would think might be helpful for them?
I think just making sure that the lines of communication are open and that you feel able to ask questions. Certainly as a sibling, feeling able to ask questions and have conversations, just generally, which I think my parents definitely did. They would have been happy for me to speak to them. But then also having kind of specific, opening questions, I suppose, sorry, the baby's making noises. Specific opportunities, because I think I know that they would be very happy. They would have been very happy to talk about things growing up, but just having, the opener of, is there anything you want to ask about that, or is there anything you want to talk about that, would have probably opened up a lot more questions from me, rather than just there being a blanket general attitude of being able to discuss things. Actually having specific openers of, I don't know, whether it was not all the time, but just at particular occasions, be that, Beth's birthday or something, or if we were going to a soft conference, after something like that, then maybe giving me the opportunity to talk about anything that had cropped up or was on my mind might have been helpful. I think otherwise, lots of people within Soft say it's invaluable just to speak to people who have had those similar experiences. So the fact that, Soft's trying to do more about getting different groups of people together to have those conversations is quite helpful. So be that, subsections of siblings or grandparents, or people who are caring for a child, or those that are bereaved. So within Soft, I think being able to speak to other people that have been through similar is useful as well.
Did you have grandparents around when you were growing up?
A bit. They weren't around, like they lived quite far away. We weren't overly kind of close to them. We didn't see lots of them, and I don't think they ever mentioned Beth, actually, really.
No, I'm wondering that again, the role of grandparents in parenting their adult child, and also being the grandparent of either the sibling who is affected or the sibling who's died, is actually, it's a mammoth task. It's almost like a double whammy for grandparents. So I'm not surprised that maybe there wasn't that conversation.
No.
And as you say, if you didn't see them very often, then probably the conversation didn't it didn't come up naturally in that sort of ebb and flow of sort of just everyday conversation, did it? Danny, can you sort of talk to us a little bit about how your sister's short life and then her death has actually shaped the person that you are today?
I think it's made me very grateful for kind of normal family life as much as we've had. I knew that they'd obviously had Beth, and she had survived for the 3 months, and it'd been really traumatic when they lost her. So the fact that then I had, my older siblings and my parents still, and I think they, I don't know, it doesn't necessarily make you appreciate things more, but I was very aware that I was a very wanted child after all that grief that they'd had. So I think, as a child growing up, and also now having my own family, it's made me appreciate that more. Also just growing up around Soft and, getting to know families and getting to know children with trisomy, I think it has made me more empathetic, and I think before we've talked at conferences and things about how lots of siblings of children who have had trisomy have then ended up going into kind of caring professions in one way or another. So I work as a GP now, and I think it probably has shaped, you know, my choices with regards to, you know, career and things, and also then shaped at work, kind of helped in some ways that I've got that. So I don't think, I remember Mum saying that she worried about, you know, the negative impact of having had a child with trisomy would have had on A, my older siblings, but B, also me coming along afterwards. Whereas actually, you know, I think there's a lot of positives to be had from that, from either having a sibling who is, you know, disabled and alive and thriving, or having had a sibling who's passed away. Yeah, I think it probably has shaped how I am, and some of the decisions that I've made, but in a positive way, I suppose.
Thank you. You talk about being a GP now. I'm just wondering, for if you could just tell us, Danny, what is the likelihood of you as a GP having patients come to you who have a child born with a genetic life-limiting condition, or are expecting a child with a genetic life-limiting condition? Is this something that you have seen, or something that you still consider is quite rare?
It is. I mean, it is still quite rare, but I have come across it with work, because during medical training you often rotate around different departments. So
Yes.
I've done jobs in obstetrics and been in medicine units, and but also even in GP. A couple of years back, I had a lady who was pregnant, whose sister was pregnant at the same time, but the sister had had an antenatal diagnosis of, I think it was T18. So she was just coming to see her GP because she was so stressed about the situation and the impact on her pregnancy. So actually being able to then, and she didn't know how to help her sister, and she also felt guilty because she was pregnant at the same time with an uncomplicated pregnancy. So being able to, as the GP, go, aha, actually I do know about this, and there's soft, and there's this, and there's that, and tell her to go here and look at that. And I think, you know, it was lucky she happened to come to me, but equally, you know, she could have gone someone else who'd never really heard of trisomy or had any experience of trisomy. So yeah, I mean, they are still relatively rare conditions, but I have come across them in work in hospitals and GP, and it just means that I know what to do. Like I can know a lot better how to. It's not that you can fix things, but I know a lot better how to help and support than I would have done.
Yes.
Had I just had medical training and not had that. So.
And would you say that actually GP training now includes more about genetic life-limiting, life-threatening conditions, or
there still isn't that much? So I incorporated it in our, so during our GP training, we used to have kind of weekly sessions with all the GP trainees together. We all used to have the speaker come in to do something, but we also used to teach each other. So I incorporated it in our training for our group. But otherwise not much really, because I mean, and you can kind of understand why in GP, and that there's so much to cover, and it is something quite rare. But I did, when I was working in hospital, try to get more of the soft information out there, and because part of it is just spreading awareness, isn't it, that there are, it's getting better, but there are still some people that hear of a diagnosis of trisomy 13 and 18 and go, oh, incompatible with life, and which is what we're trying to steer away from. And I think it is getting better, but there's still a lot more that needs to be done as well. How to do that, that's always a kind of a quite prominent question within soft, and it is something that is improving, but with rare conditions it is always going to be quite tricky to make sure everybody knows everything they need to, I suppose.
Yeah. Okay, well, thank you very much indeed, and yeah, I wish you well with bringing up your family.
And this one, who probably wants to go to bed now, don't you?
I'm sure so. I'm sure so.